Let us say that a young man walks into your OPD. His body language seems to be very shy and embarrassed. He sits down. He starts describing his symptoms. He initially tells that he feels weakness, tiredness. He feels drained all the day. He feels I cannot concentrate on my studies. I cannot concentrate in my work, and I am just exhausted. And I am just, I'm just collapsing. My health seems to be all deteriorating. Now, on further inquiry, this patient reveals that he feels as if he is losing semen via urination. Basically, he's losing semen in his urine while he's peeing, or he may give you an alternate history that he's losing semen in nocturnal emissions, nocturnal ejaculations, or there may be a history of masturbation and guilt. Any of the following, that he's just concerned that he's losing semen. You do the examination, you order some basic tests, examination is normal, basic tests are normal, everything is normal. Now, what is this condition? There can be two scenarios which can happen if you don't know about this condition. First thing is, you will over investigate, and that is going to cause problems. Second thing is, you are going to reject this condition, you are going to say this condition is all nonsense. That will also cause problems to the patient. What exactly is this condition? This is Dhat syndrome. This is something very much frequently encountered in Indian clinical practice, yet it is not talked about very much. So today let's learn Dhat syndrome from the very basics. Let's understand what exactly it is and how you as a doctor will manage it if you ever encounter it in patients. And believe me, you are going to encounter it if you run an OPD. Secondly, this video is for strictly medical audiences. If you are a patient suffering from Dhat syndrome, I advise you to visit your local or your regular family healthcare professional first and get yourself evaluated. This is not treatment suggestions. This is only for educational purposes, and it's meant to be for medical students and doctors. So let's jump right into the essence of this syndrome. What happens in this syndrome is that patient is having a distress. Patient is having a distress that he is losing semen. He's having a distress that he is losing semen, and this loss of semen is causing him tiredness, weakness. Let's say he cannot not concentrate. Okay, and the list goes on. He has a list of somatic symptoms. Now, how is he losing semen? He may be losing semen. He may believe that he may be losing semen in urine. That is, when he goes to pee, he accidentally pees his semen too while peeing. Or he may be losing extra semen by extra masturbation. Other thing, he may be losing semen via, let's say, defecation. Anyway, the central core is that this person is losing semen, and because of the loss of semen, he believes that because I am losing this semen, I am having this physical symptoms that I am not well. Why am I not well? I am not well because I am losing semen, and since I am losing semen, I am not well. So this is called as Dhat syndrome. Why exactly does Dhat syndrome happen? See, Dhat syndrome is a culture bound phenomena. It is seen only in certain cultures, not seen everywhere in the world. It is seen only in certain cultures. So where it is seen? It is seen in countries like India, Pakistan, Bangladesh, maybe China, Sri Lanka. This part of the world, this Dhat syndrome is very common. See, both the DSM-5, these are manuals of diseases of psychiatry, DSM-5 and ICD-10. Both of them recognize Dhat syndrome as a cultural bound syndrome. Cultural bound syndrome just means that, see, basically the culture in which you grow up changes your disease perception and disease expression. The culture has a role on how you perceive a disease. Let's explore the cultural roots of Dhat syndrome. Basically, even in Indian tradition and even in ancient Greek tradition, Greek tradition, Indian tradition. In both the traditions, semen holds a very important value. Like for example, the word Dhat syndrome comes from the a Sanskrit word dhatu. Dhatu which means element or metal. And they say that body is made up of a couple of dhatus. And one of those dhatu is virya or semen. And semen is considered to be very important. Like Ayurvedic scriptures, they say that 40 drops of food make one drop of blood, and 40 drops of blood make one drop of flesh or one drop of finally semen. So semen, overall their belief is that semen is very important, highly essential for life force. If you lose semen, you are losing strength. So this is what their belief is. Therefore, if a person who grows up with such a cultural belief, if he loses semen or if he has the belief that he is losing semen, this is going to cause extreme anxieties. This is going to cause extreme anxieties and this is going to cause extreme distress. Now, this is the basis of this disease. Now, who coined this word Dhat syndrome? The term Dhat syndrome was coined by this person. This person is Dr. N. Vig. N. Vig is an Indian psychiatrist considered one of the pioneer of Indian psychiatry. He coined the term Dhat syndrome in 1960s. For the very first time, he used the term Dhat syndrome. Then what happened is that in the 1990s, Dr. R.K. Chadda in the British Journal of Psychiatry described Dhat syndrome as a sex neurosis of the Indian subcontinent. Then we come further to the modern times. In 2013, this is a PubMed article. In 2013, Dhat syndrome was further reviewed by more Indian psychiatrists like Kaushik Sinha and Yatan Pal Singh. So this is a very well recognized phenomenon. Now let's talk how the clinical presentation is going to be. First of all, remember that a patient won't walk into your OPD and confidently say, Doctor, I have Dhat syndrome. That's not going to happen. There can be three ways in which the patient presents to you. The first way is he presents to you with somatic symptoms. Okay. Somatic symptoms are, they can be weakness, they can be tiredness, difficulty working out, lack of energy. These kind of symptoms will be there. Second is psychological symptoms. Now, what can be the psychological symptoms? Most important psychological symptom will be low mood, inability to concentrate. Lastly, a small minority of patients can present to you with symptoms of loss of semen. Loss of semen. How can the semen be lost? Either they will say, I am losing semen through urine, or I am losing semen through defecation, or excessive masturbation, or nocturnal ejaculations. Now, when a patient presents with somatic symptoms and psychological symptoms, and you inquire further, these patients who are having somatic and psychological symptoms have a strong belief that these somatics and psychological symptoms are caused by loss of semen. This is what separates Dhat syndrome from other somatic and psychological conditions. That the belief is very strong that I am losing semen, therefore I am experiencing this. Now, where can you do the mistake as a doctor? As a doctor, if you treat the somatic symptom without treating the underlying cultural belief, then you are doing what is wrong. You are only hitting at the somatic symptom, but the somatic symptoms will keep coming back as long as the cultural belief and the strong association between loss of semen and somatic symptoms is going to be there. So as a doctor, the grave mistake which you can do is or just keep ordering some unnecessary test and keep giving stuff like multivitamins, or keep reassuring for his somatic symptoms. That's the worst thing you can do. So what to do? I've broken the approach into a 4-step process. The first step obviously is what not to do. what not to do is never dismiss the patient's symptoms. Never tell the patient that, see, it's all in your mind. You do not have any problem, and just go home and relax. Never do this. The moment you have said this to the patient, you have lost the patient, and you have also done a harm to the patient, because now he is not going to trust another doctor and open up in front of him. He had built some trust, he had controlled his embarrassment, and he opened up in front of you. If you straightforward ridicule him, dismiss him, then it does a harm to the patient. So never do this. Never straightforward dismiss the patient that it's all in your mind. So what to do is to listen carefully, empathetically, listen and explore. Step 2 is listen and explore. Exploring is very important. What to explore? Explore the cultural beliefs that the patient is having. He may be belonging to a very conservative family. Generally, these patients are in the lower middle class, and they are having conservative beliefs about sex, and they do not have that much of sex education. On top of that, in the current day, YouTube is filled with no nut and anti-fap movement and all of that. So all of that holds a cultural belief. So you first understand what is the mindset of the patient. Now that you have understood the mindset of the patient, move to step number 3. What is the step number 3? Step number 3 is examination, physical examination, and you can order some basic tests. Don't go overboard, just order some basic tests like maybe a urine analysis, simple tests, okay? Simple blood test to rule out any anemia, etc. Just go with the simple and most basic tests. Make sure that it's not something pathological. Once you have done that, now comes the most important part. And if you do this part, the most important part, I'm coming towards what is the most important part. And if you do this part, you will be better than 90% of the family healthcare doctors, the primary physicians. You will be, I'm definitely telling you that you will be better than 90% of the family healthcare doctors in India if you do this part. This part is understanding that Dhat syndrome, many a times, Dhat syndrome is just the mask of an underlying psychological problem. The underlying psychological problem may be depression, it may be anxieties, it may be some personality issues. Okay, so you need to now find out that this person is not suffering from any other psychological problems, because other psychological problems many a times do not present directly, they present as Dhat syndrome. Okay, so Dhat syndrome is many times the presenting things of other psychological things. So you need to find out if there is anything like that. Now, coming into a more detail, I'll use this pyramid model. First thing, what you need to do is, after you have understood everything about the cultural beliefs of the patient, provide some basic sex education to the patient. This, if you do not do, you can recommend to a sexologist or a psychologist who can do this, and resolve the anatomical myths that they have regarding semen production. Basically let the patient know that semen is not a very vital thing of the body, and occasional loss of semen during nocturnal emissions, occasional masturbation, this will not affect the body's physiology. So once this is done, this forms the foundation. Without this, all other treatment is useless. So this is the foundation. Next comes CBT, cognitive behavioral therapy. This will be done only, this and this level are to be done only by a psychiatrist. Okay, psychiatrist, or CBT can be done by a psychologist. So your role actually ends here, but I'm still going over here just to give you an overview that CBT can be done. And once, if there are comorbidities, like I told you, many times they suffer from depression, many times they have personality issues, they can have anxiety issues, so the psychiatrist can put them on SSRIs. Remember that SSRIs to be preferred are the SSRIs who generally do not have sexual side effects like bupropion, and they are generally in low doses. As doctors, what Dhat syndrome teaches us is that what a patient believes affects a lot on how he perceives the disease, what is happening in his body. That is how much is the power of belief. One thing is that social media plays a very important role in shaping the cultural beliefs. And nowadays, what I see is if you scroll through the social media, 80% of the information you get about the beliefs of semen loss is fake information. And who is circulating this information? There are two categories of people who are circulating this information. First are alternative medicine people, or quacks, who I like to say quacks. If they are circulating this kind of information, it is okay, it is a forgivable offense. Okay, we are not having, no, I do not have any expectations for them from them, so I am not mad at them. So there are second type of people who are spreading misinformation. These type of people are generally qualified MD, DM, MCH doctors who are having big YouTube channels. They may be urologists or sexologists, and they spread this belief that loss of semen, they make videos of masturbation guilt, and they spread this belief in the society, which reinforces the behavior that a loss of semen is equal to loss of strength, and they reinforce this. So why do they do this? They do this because of a simple thing, and that thing is called as money. Because if a patient is having that syndrome, he is having insecurity about sex and sexual performance, then this insecure person will go to a urologist or sexologist and will get a cosmetological procedure done, like penile enhancement, P-shot, these kind of operations. Okay, so because for money purpose, they are spreading this type of reinforcing the cultural beliefs that yes, semen is very vital to the body. Because of semen, you will look young. This kind of information, this is new, that even MD, DM, MCH doctors on YouTube are spreading this kind of information. Therefore, I feel that I will come up with real scientific literature, with review articles, and teach to medical students and doctors, if they ever encounter a patient of Dhat syndrome, how should be your approach. Thank you. Keep watching my channel. I am doing a complete series where I am discussing all the psychiatry for undergraduate syllabus. Take care. Stay blessed. Bye bye.